Next, we have Dr. Mita Joshi, who has been with us since the beginning of this instruction course. So this instruction course has been running for the past 5 years in all the AIOCs. She is going to talk to us about the latest in the apps for smart ophthalmologists, iApps, Go Tech Savvy. Over to you, Dr. Mita Joshi.
Thank you, Dr. John. Good morning, everyone. Thank you for being here. And I'd like to thank AIOS for this opportunity. We all know apps are a self-designed program or a piece of software designed to fulfill a particular purpose, which can be downloaded by the user on a mobile device. Apps are now a part of our daily life, and we have apps in ophthalmology which perform a variety of functions such as medical education, practice management. We have our books and journals on apps now. We have our whole conferences on the apps now, and there are apps for patient utilizations. Apps for imaging would be dealt with by Dr. John. Medical education, you have lots of apps. One of the most important ones which I find the most useful one, handy one in our day-to-day practice is the eye handbook. It has a variety of features such as testing of the patient. You have the Amsler grid, the color vision chart, contrast sensitivity, duochrome test. There is a fluorescent light also, so you can examine any bedside patient for an ulcer or something just by simply staining and using the screen as a fluorescent light. And there are near vision charts also. Contrast sensitivity, like I said, you can just test easily in a handy manner. Worth 4 dot test for the diplopia patients you can have for distance as well as near. Distance we usually have in our charts. For the near, you can use this your own phone as a device. Color vision, we all have the little black book in our OPD, but for over a period of time the plates tend to fade out. So you can use the app as a device for checking out color vision. Pediatric cases, you can have pediatric optotypes and fixation targets so that the kids also enjoy looking at a device and you can simultaneously check their vision. There are settings given, so you can have your laser settings at your fingertips and you can just recheck them before performing a procedure. Calculators, which Devika also mentioned, are given within the app also, so you can just use them for your day-to-day practice. There are diagrams given which you can use to explain to the patient certain diseases. Vision symptoms are described so that the patient can easily understand what's going on. The another app is ophthalmology, which gives you a short précis of the diseases, so you can just have a ready reckoner at your hand. DrawMD allows you to take pics and draw onto the template itself, and then you can share these with your patient via email or print. iTube is the YouTube. You can have a lot of surgeries on this. Just go through them quickly so that before going into your OR, you have a quick revision of the procedure which you are going to perform. Glaucoma risk calculator is based on the OHTS studies. You can enter in the data and it will give you the risk assessment and just an outline of the treatment which you can plan. This is one of the few tests which everybody struggles to do, and this you can have an app online and just use it so that it is easy to perform in your OPD. TLA, there are a lot of short forms in ophthalmology and TLA helps you with that. Just put it into the app and you'll have the full form of the required. EmbryoCare allows you to give home exercise to your patient so that with your patching you can have exercises also. Snellen charts are also available now onto the phone, so you can just download them and have a quick check. The toric IOLs are progressing and you can have toric markers as well as calculators which you can have on your phone. Practice management apps used are Dropbox, so you can share your documents. You have scanners, so you can just convert the OPD paper into a PDF and share it. OCT browsers are available, cam cards are available, which you will just screen and convert a piece of paper into a digital data. Epocrates and Skyscape help you with your medication. Epocrates, you can just have a quick look at whatever medicine you are planning to use. Apps for medical journals are also now there. We have our own IJO on the app. Apps related to conferences, we have all the data of our conference on the app, so you can see which sessions are going on and plan accordingly. These are the apps which you can advise your patient to download on his or her phone. And since we have elderly patients, these are very useful apps so that they can monitor themselves. You have low visual aids, we'll be coming to them shortly. The side book also helps you. It has a built-in AMSLR, so you can just ask the patient to do a weekly check and get back to you if there are any changes. So this you can just it gives you simple directions also, so the patient can follow and then report back to you if there is any abnormality. This is a test for contrast sensitivity. The size and the contrast keeps on changing, progressing, and the patient can just keep a track at which level he was previously and then which level he is now, and come back to you if there is any problem. Eye drops, this is a very important app, especially elderly patients who are living alone. So this you can ask them to download, put in, just feed in the data, feed in the timing of the drops which has to be put, and the patient can then easily put the drops without forgetting. Be My Eyes, this is available outside, not in India at present I think, but this allows patients with low vision to just go around, and if they'll send out a help signal, and there'll be someone online who will be willing to help them out. For your young patients, you can have fancy contact lenses which you can ask them to just check in on a picture without putting the lens, and then select the type of lens they want to wear. Now this is one of the things which I just recently learned. I have a cousin who's losing vision due to diabetic retinopathy, and his day-to-day working, his office, how he's managing this I've just managed to learn now, and I'm imparting it so that you can give it to your patients also. There are certain web content accessibility guidelines, how your website should work and what all features should you have so that persons with disability can learn them. So you have screen reader software, speech recognition software, special keyboards are available, and you have screen magnification software. These are especially useful for the ARMD and macular degeneration patients. So this feature is available on the phone, the narrator. What it does is, it describes your surrounding, and all the instructions are given verbally so that the person can listen to what is going on rather than just read.
Not show me again.
Okay, button. Lookout explore mode. Help, button. Shelf. Double tap to activate. Backpack.
So in case you are going to a new place, it will just on.
Ring.
This is a reader, so just
3 of 6. Text. Selected. Double tap to select. Lookout text mode. Retinal diseases. 3rd edition. JSPAHWA. OPBILLORE.
so you can read. And the Kindle is also available in an audio mode, so the books also can be read. And you can design your own app, you have your own hospital featured in it. So patients can know about the team which you have. You can have fixed appointments through this app, give feedback, and stay in touch. There are certain issues with apps like patient privacy, what kind of data which you will be sharing. Cell phones are notorious germ carriers, so you have to be very careful when you introduce them into your OR. Sharing over social media, again you have private confidentiality issues. And then you have the authenticity of the app, the data which the app is giving you, how genuine is it. And FDA approval of apps is not far away. Thank you so much.